Like to introduce you to our presenters. So we've got a great, bunch of providers here from our sports med team to talk about COVID-19 in sports. So we've got Dr. Rex Guido here, who is just one of our family medicine, sports medicine physicians, and he's located up in Ithaca, New York. He's going to discuss the impact of the COVID-19 pandemic on the current sports environment. And also here tonight are Emmeline Setzer and Brian Howland. Emmeline is one of our physical therapists down in Sayre, PA, and Brian is one of our athletic trainers. He's also based in Sayre, but he actually covers Waverly High School. So we're going to hear from both Brian and Emmeline about returning to sports after a period of inactivity, such as during a pandemic, and how to really do that safely. We also have on this call Dr. Don Pikett. He's another family med, sports med physician at Guthrie. He's down in Sayre as well. So along with Brian and Emmeline, Dr. Pikett's also going to be giving his thoughts on return to play. So I think that's the rundown. So without further ado, we'll go ahead and get started. Dr. Guido will be up first. So Dr. Guido, you can go ahead and share your screen.
Thank you, everybody, for coming. Really appreciate it. Thank you, Kate, for moderating. We hope that this is both an enlightening experience for all of you, and just an opportunity for us to share what we can provide here in the Guthrie system. So what I'm going to be talking about tonight is essentially a historical parallel regarding what we're going through right now and how the experiences that we had in the past can sort of shape the direction to which we're hopefully headed. And since the pandemic started and spread worldwide, it really has disrupted a lot of what we would consider normal. Social distancing measures, mask use, business shutdowns, virtual schooling, limited social gatherings, they've all been used to sort of help curtail the spread of the disease for our own good. In that same token, however, it's also affected important aspects of our daily lives, of which sports is a big part of. And so this quick presentation aims to provide insight into how COVID-19 has affected sports, physical activity, and well-being. And by understanding the degree to which it's affected us, we can better understand ways to adjust moving forward as things improve. The global value of the sports industry is estimated between $471 and $756 billion annually. March Madness, the Olympics, the Super Bowl, you name it, all of them have been affected by the coronavirus. This valuation in billions of dollars not only includes professional sports teams, but also involves the retail sector, travel, tourism, transportation, dining, media, and all sports-related industries. So when sports are canceled or games are rescheduled, the financial impact trickles down to not just the fans, but also the workers involved in making sports happen. So we've all seen in the news and heard about, stories about collegiate and high school sports shutting down. And for some of these schools in the collegiate setting that rely on athletics for sports and support, some of them have unfortunately been unable to keep their doors open. So clearly there is a detrimental effect on the sports industry as a whole as a result of this pandemic. Measures to, this is a picture obviously of Planet Fitness, but it aims to show the measures that have been used to reduce, the spread of the infection. And one of the places that's really affected are gyms, obviously. Whereas people before had environments at which they could work out and socialize, now people are forced to find ways with which to work out individually at home. And for some of them, this is a welcome change. But unfortunately for others, it's resulted in considerably less physical activity. This decrease in physical activity has also likely correlated with poor eating habits, increased screen time, inadequate sleep, and increase in weight. which we all understand has its own correlations with poor health outcomes, including poor mental health. So now the question remains, where do we go from here? We might be able to find answers by looking to our past, specifically the 1918 flu pandemic, in which 500 million people became infected, with an estimated 10% of them dying. It was said to originate in the United States, but became known as the Spanish flu due to the fact that Spain did not censor reports of flu in their country, leading people to think that there were a lot of cases there. Interestingly enough, there was a higher than expected mortality rate for young adults, but factoring in malnourishment, overcrowding, poor hygiene, and a recent world war, those other factors could have also contributed to affecting the younger population who had just come home from the fighting. So this is a picture that, were it not for the black and white photography and use of hats, we might mistake these photos for some time that's more recent. But yes, these were in fact taken during the 1918 pandemic. Many of the methods that are employed during our pandemic were similar to the ones that they did back then. They enacted travel bans, closed schools, theaters, churches. They limited public transportation and banned mass gatherings. Face masks were very common, as you can see in this picture. Businesses were opened and closed in a staggered fashion to limit crowding in the subways. Unfortunately for them, there were no antivirals to treat the illness. A lot of lives were lost. And it was not until a year later, by the summer of 1919, that the flu pandemic came to a close, as those that were infected either died or developed immunity. This is a picture of the 1918 Washington University football team, and here they are wearing masks. So it begs the question, how was sports affected by the 1918 pandemic? Health officials urged the wearing of face masks between 1918 and 1919, and some programs like the University of Washington University here, did that. Unfortunately, there was a high resistance to their use because people claimed that it was a violation of their personal liberty, which is an excuse that you even hear even today. Other ways that the 1918 pandemic affected sports was that they shortened the majority of sports league seasons, from college football to professional baseball. They did not have a strict restriction on attendance, and that measure unfortunately led to the deaths of a few of their professional players in the NHL, in boxing, and even horse racing, who eventually died from the flu. Yet, interestingly enough, once the pandemic resolved, it actually led to a boom in sports, which was a response to the pent-up demand for people to have something to do. In the 1920s, historic venues such as the Rose Bowl, the Ohio Stadium, the Tiger Stadium, all of these did not exist prior to the pandemic, prior to the 1918 pandemic. But afterwards, during that boom, all these, highly recognizable stadiums were built. In that decade, college football game attendance more than doubled to more than 10 million per over the year. At that time, too, Babe Ruth made his debut as a Yankees baseball player. And in boxing, Jack Dempsey won the heavyweight title as New York State actually legalized boxing after having banned it years before the pandemic. All in all, these examples aim to show that sports had a resurgence after what happened. But it was only after it ended that people were more comfortable with going out and living a life of normalcy, which included sports. Winston Churchill famously said that those who fail to learn from history are doomed to repeat it. The significance of that in today's time, can't be underestimated. It just goes to show that, sports, like history, is an integral part of the American fabric, and we can learn from the many lessons of the past. I wanted to show that some of the things that we do now were things that we did back then. And in a sense, we've been through this before, and we've only come out stronger than ever. So, we should strive, and remind ourselves that we have to continue to do our part, to do the right thing, continue to socially distance, get the vaccine, and prepare for the resurgence of sports, which is sure to come once this is all over. But we can't get there until we do our part.
Awesome. Thank you, Dr. Udo. Yeah, thanks, Dr. Udo. That was really interesting. Like you said, the more we learn about this sort of thing and talk about this sort of thing, the more comfortable I really feel with what's to come. So that made me feel pretty hopeful. Thank you.
Thank you, Kate.
So now let's hear from Emmeline Setzer, Dr. Pikett, and Brian Howland. They're going to be talking about how to return to sports after inactivity. So team, go ahead and get started.
All right. Can you hear me, Kate?
Yes, I can.
Okay. So, all right. So, as Kate mentioned, my name is Brian Howland. I am an athletic trainer at Waverly High School, obviously working for Guthrie. I'm a sports medicine team leader as well. And I have with me Emmeline Setzer, who is the team lead physical therapist here at Robert Packer Hospital in Sayre. And also, not currently with me, but in another room here in the hospital is Dr. Donald Pikett, who is our sports medicine physician, oversees our program, is a phenomenal asset for us, and he will be jumping in to assist. All right. All right. So just a little introduction. Due to COVID-19, as we're all aware, sports have been suspended and delayed, or they were for the last, March 13th was the last day that I had at the school where we had sports up in New York State. Pennsylvania obviously relented a little sooner, but many schools could not even have open gyms, lifting sessions, etc., which led to many athletes being away from the state competition for 6 months or greater at the high school level, which can certainly lead to some issues, which I will be turning over to Emmeline Setzer to describe.
Hi, I'm Emmeline. Thanks for joining tonight. So I feel like we can't talk about COVID without at least highlighting those changes that's really caused the increased stress in our life, those sedentary behaviors, social isolation. Even for the athletes, time away from school, friends, a team environment, it can have a big impact on training and returning to sports. Even though we all have great intentions of we're going to continue our workout habits, maybe we're going to add something new. When you lose that friend aspect or that team environment, it's really hard to push yourself to that high level of competition. So that can have a big impact on training and the conditioning level for a lot of athletes coming in and trying to get back to their sports teams. And there's also the change in dietary habits, increased snacking, more junk food. Again, it's easy to say that we're going to try to turn a new leaf and we're going to keep making those changes, but COVID's really uprooted all aspects of our life. So why is it a problem? Well, the inactivity can lead to muscle loss, a decrease in bone density, a decrease in the aerobic capacity, and an increase in fat stores. All of these are the big changes that will lead to the increased risk for injury once returning to sport, especially from going from those sedentary behaviors to trying to jump back into a high level of competition. So the big things that I'm going to highlight and talk about is just some strategies to hopefully help to reduce that risk of injury and help to slowly prepare your body to get back to that high level. So some tips for reducing risk of injury. You want to make sure to incorporate sport-specific tasks to prepare the muscles, tendons, and ligaments for the loads that they're going to experience. It's great if you're going out for 1 to 2 mile runs or you're doing some lightweight training, trying to stay in shape. However, if you're participating in a sport that relies on sprinting, jumping, landing, you want to make sure that you're going to incorporate those type of movement patterns to your exercise. You have to get your muscles ready for that takeoff, for that landing force. Just a straight line running on a level ground is going to be completely different impacts for your body. So if you don't take the time to prepare, it's going to increase that risk of injury when you finally start to get back to your sports competition. And also try to allow for at least 4 to 6 weeks to get your body ready. You can't overtrain to try to catch up. So it'd be like if I'm going to say I'm going to go run a marathon in 2 weeks and I'm going to try to run 10 miles a day. I'm probably going to just hurt myself doing that. And it's the same concept. You have to make sure that you give yourself weeks to ramp back up to that high level of activity because it's going to take time for your body to adapt. I just wanted to highlight that cross training is a phenomenal way to give your body some active rest as you're trying to get back into an exercise routine, but it keeps yourself moving. So as we're trying to get back to training, you really want that 5 days a week. You need at least 2 days to let your muscles rest and recover, but you want to make sure that you're working different muscle groups. So by cross training, so if you're a swimmer, doing some land strength training or going for a run for that conditioning aspect is going to let your shoulders relax, but yet you're still keeping your body active. Yoga is another great exercise to incorporate. You get that stretching and just general movement, so it can be like an active recovery day, but you're taking the time to give your muscles a break to prevent that overtraining. I also want to highlight that proper nutrition is really critical during this return to sport time period. So trying to get back to making sure you're eating a balanced diet. Really emphasize that protein intake, vegetables, fruits, and whole grains. So just trying to limit the sugar intake and just making sure you're eating a good variety. And sleep. Sleep is probably something that we take for granted, but really that 8 to 10 hours a day is critical. The sleep and the rest is what's going to let your muscles, tendons, bones, everything heal and recover, especially as you start to, again, increase back to those prior levels. So how can you safely return? Make sure as you're getting ready for training, you want to make sure you have time for a proper warm up, 10 to 15 minutes of doing dynamic stretching, kind of like what the picture highlights. There's a lot of different movement patterns you can do, but try to think about some sports-specific movements. A light jog, riding a stationary bike, and doing a little bit of strengthening core stability. So that warm-up should take about 10 to 15 minutes before you get into your hard intensive training. And then at the end, taking time for a cool down. Stretch, hydrate, foam roll, and again, sleep. You really need that sleep and rest in order for your body to get back to where it needs to be. And this is just a general reminder. So even before COVID, the American Academy of Pediatrics recommends to not train more hours in a week than a child's age, and that you do need 1 to 2 days of rest. So if you have a 13-year-old child, really they shouldn't be doing more than 13 hours of a sport-specific training within that week time period. So just something to keep in mind. And as a reminder, don't work through pain. This isn't a time to take a no pain, no gain approach. Pain is your body telling you that it needs a break, and it's not something to ignore. Don't try to ignore it and continue through your activities. Talk to your athletic trainer at your school if you have one available. Seeking care doesn't mean that you have to stop. Oftentimes, an athletic trainer or physical therapist, we can try to provide some movement strategies or tips to help to stop the problem before it gets worse. And we can work with you on trying to keep you going through your training so that you can get back into competition. We're not going to try to keep you from doing that. All right, I'm going to hand it back to Brian.
All right, thank you, Emmeline. That was great. Lots of tips we should keep in mind, even pre-COVID, but especially now. So, jumping right into the hot topic that schools and athletic organizations, professionally, collegiately, and even local high schools are now facing, how you should return to activity after a positive COVID-19 diagnosis. So we will jump right into that, and Dr. Pikett is going to help me with this. So to start it off here, coming back from a positive diagnosis, following a period of quarantine, athletes are going to need clearance from their primary care provider. Once you get that, obviously that's just one step in the process to safely return to sport so that you are not putting yourself at risk for some of the other health risks that are associated with COVID-19. You really should follow a safe and gradual return to play process. And this helps you to pretty much, evaluate if any risks are going to show, such as myocarditis, which I'm going to turn over to Dr. Pikett for him to discuss.
Okay, thanks, Bray. I'd like to welcome everyone. I'm glad everyone was here. I'm gonna turn my camera on. Myocarditis has kind of been a big buzzword in the sports medicine realm since COVID came around. It isn't anything new though. It's been pretty well known that, like Brian has on the slide here, it's an inflammation of the heart muscle, and it decreases the ability to pump. It can put you at risk for a lot of problems. A lot of times, many things can cause it. So myocarditis just means inflammation. There are many things that can cause it, very medical conditions, but the specific thing that we're talking about is what happens after a virus. We've known about this for a while. This is why we usually try to get people after they've had like a systemic viral illness to not exercise. But in the past, we've always called a neck check. So if you had a cold and all your symptoms were above the neck, a little bit of runny nose, a little bit of stuffy nose, but you had no fever, no muscle aches, no maybe some GI stuff, you're probably okay. The concern was if you did exercise while you had that fever, while you had all the kind of the achy stuff, the stuff below the neck, you always ran the risk of this myocarditis. When COVID came out, we actually found a higher incidence of this, and they were seeing a lot of it. As a matter of fact, when early on over the summer, I know the Big Ten had done some data, and they came up with really high numbers of a lot of the players who had COVID that were running the risk of myocarditis. They've since the numbers ended up being a lot lower, but it's one of the reasons they kind of reacted as far as initially wanting to postpone their season. So this is really where our delay has been coming, and a lot of the guidelines that we've been putting forth, and I know that the other health organizations like UHS in the area are doing something very similar. So what we're trying to do is to come up with a plan to get athletes back, but get them back safely. I'm going to change the slide, Brian. So what we've asked is the first thing that you need to do is wait until you're done with your the quarantine period. So this has been a moving ball too, that we're waiting at least until you've gotten 10 days after the onset of symptoms or after when you've had your diagnosis. It had been 14, they've since moved it to 10. We do want you to go see your PCP to verify that you know how bad your symptoms were, making sure that you haven't had a fever for the last 24 hours, and make sure that your symptoms are getting better. We realize that some of the symptoms may hang on, especially we're noticing lack of smell and lack of taste has been hanging on a little bit longer. But we want to see the symptoms improving, and most specifically, we want to make sure that you're really not having any marked shortness of breath, chest pain, palpitations, passing out or close to passing out. And what we also want to make sure is that if your doctor has or your provider has done a good exam on you, especially looking at your heart and lungs and making sure there's no sign of any problems with that. This is a form that we've developed. I know UHS has another form. It's nothing I think that's required. We've made it available to the local schools. And what this does is it says that you have seen your doctor. We've made sure we've gone through the criteria that we've talked about here. And then what we've said is if most of the people are having, especially the young athletes, if they've got mild symptoms, They probably don't have a fever for more than about 4 days. You know, they maybe had a little bit of sore throat, a little bit of achiness, and but it wasn't severe. So those kind of people, usually once they get through the 10-day, or if they had no symptoms, a lot of times they have no symptoms at all. If those kind of people, once they've seen their PCP, they found out that they're getting better, their exam is normal, then they will sign off, and you have the return to play protocol that you have set out here. It's kind of similar to what we do for concussions. The idea with this is, like Emily had said, getting you back into a gradual return to activity and making sure you're not symptomatic. We want to, and what we do is we start out really easy stuff and then gradually get a little bit further and further along. Now, the guidelines we use here are the guidelines that have been put out by most of the major medical organizations. You know, we looked at the guidelines from the American Medical Society of Sports Medicine, the American Academy of Pediatrics, the British Medical Journal of Sports Medicine, the American College of Cardiology. So, yeah, it seems like a lot of people are saying, "Oh my gosh, we've got a shortened season already. I've got to wait for the full 10 days, and then I have to do this gradual return to play." And it does seem like a lot, but it is what's really important to, you know, to get people to get back and get back safely. Now, for those people that are more symptomatic, really, their fever lasted more than 4 days. They really did have shortness of breath. Maybe these are the people that end up going to the hospital. Those are the people that may need a little bit further evaluation. They may be doing an EKG. They may do some blood work. They may do an echocardiogram, which is an ultrasound of the heart. And those are the people that your provider may ask for you to see a cardiologist. So a lot of the dividing line there is going to be the difference between, you know, how bad and how long your symptoms were. And again, this is what we were talking about. The things that we're really worried about is, you know, a little bit of fatigue's all right, but the people that are really tired out, any chest pain, cough, shortness of breath. If you find that, you know, boy, you know, just even walking around the house, going stairs, you know, these are things that we're going to probably want to have you hold off on getting back, or at least not doing anything really hard. If you're getting palpitations, dizziness, feeling like you're going to pass out, it still says, you know, we've got to really be looking into this a little bit further, or at least waiting a little bit. Okay, Brian. This is something we kind of talked about before. The people that really had more severe symptoms, or if they had to be hospitalized, these are the people we're going to be doing more further testing and potentially have you see a specialist.
All right. Well, Dr. Pikett, thank you very much for that. And I am going to steal it back. So as Dr. Pikett mentioned, most of the information we pulled from was from different academic journals. So getting into what we discussed, getting cleared by your primary care, and then the gradual return to play that we mentioned. So the gradual return to play that we are discussing is what I'm going to talk about now. We put this out to the schools as a recommendation, and if they wanted to take it and kind of adopt it how they wanted, just to kind of, you know, make sure that we're being safe for these kids due to the prolonged inactivity. So as he discussed with some of the cardiology stuff that the Big Ten did, most of these return to plays are pretty much all based off of some degree of the article that the citation can be seen there in case you wanted to look up. It was published in the British Journal of Sports Medicine, and that, when you research, that's what comes up for most of these organizations. So the process, for starters, the process should be monitored by the school nurse or athletic trainer. I know with some of these schools, especially the IAC, which is the league Waverly is in, some of the schools do not employ an athletic trainer. I know some of the schools, pretty much all of the schools within the NTL, just across the border here in PA, they do have athletic trainers, and that should be who is used. School nurse obviously as well, but the timing can be rough with the school nurse being there during the school day and not for sports. If they are unavailable, some of the schools where, you know, the coach and ADs kind of serve multiple hats, wear multiple hats rather, they can fill that role. So I'm just going to kind of run down through this. I'm not going to read the whole description, but this is essentially a 5-stage process, and it's going to last over 7 days. So the first stage is just going to kind of be light activity, getting back into exercise and kind of seeing if any symptoms present themselves. You obviously want to keep the intensity down, and you do not want to do any resistance training initially. So moving on to stage 2, you're just going to kind of ramp that up so you can add more simple activities. Heart rate is going to be a little higher, and the intensity can ramp up a little bit. And this will be day 3. So then day 4, which covers stage 3, is going to ramp it up even more. And as you're noticing the theme, you're just kind of adding more each day. It's similar in a lot of ways from that thought process to a concussion return to play protocol, how you kind of increase each day. Obviously, 2 different things, but same thought process. So then stage 4 is going to be day 5 and 6. You're going to ramp it up, and you're going to be right there trying to, if you're getting into trying to get back into basketball, you want to get back into, doing some drills, some full court stuff, some, aerobic activity that you're really going to have to work for, and it's going to simulate what you're getting back to. And then stage 5 is obviously the return to activity. So while doing this protocol, if there are any symptoms, such as the ones that Dr. Pikett mentioned previous, you should immediately stop the protocol and remove the athlete and get them back to see their primary care physician for another evaluation. This is where that form kind of comes in that we provided to the schools. It kind of allows you to see kind of where you're at, what symptoms were there. It allows you to kind of track. Obviously, the doctor is going to have stuff there as well in their notes, but this kind of helps you. So just kind of wrapping that up, coming back from inactivity and a positive COVID-19 diagnosis, in a lot of ways, it's going to be similar. You want to focus on being safe and, listening to your body. That's with both the exercise and not rushing, like Emmeline had mentioned, and trying to overtrain. But you also want to listen to it if, there are symptoms. You don't want to take that, attitude of, COVID's not going to get me. I'm good. I'm a healthy athlete. You guys are obviously listening to this because you are involved with sports. If you are following any of the college sports, professional sports, there's athletes missing full seasons, like Dr. Pikett mentioned. That's why the Big Ten was delayed. And, they're having athletes that are having long-term effects, such as the myocarditis. So you need to be cognizant of that and not just brush it under the rug. It's very important that we get them back, not only for a physical standpoint, but from a mental standpoint as well. So I think it pretty much encapsulates everything. And, it's good to get the kids back, but let's do it right and not rush this and get it shut down again. So for that, I thank you for your time. I'm all good, and same thing from Emmeline.
Thank you for your participation.
Awesome. That was all really great info. I'm sure really useful for our athletes and parents and everyone listening. Again, just the more info we have on how to manage these things, the sooner we can just get back to normal. So thanks. Yeah, all 3 of you. Thank you. So now that our presentations have finished, let's open up for questions using the chat function in Teams. If you already know where to find the chat box, you can start sending in your questions now. Please keep in mind that these messages are visible to everyone in this meeting, so don't share any personal information that you're not comfortable with others seeing. For anyone who's not quite sure how to use the chat, I'll just briefly share my screen right now and I'll show you where to find it. Okay, so this is what a typical screen looks like in Teams. On another device, it might look a little bit different, but it's the same general idea. So to use the chat function, you just want to look for the little speech bubble icon, which I've got highlighted in red here. And once you click that speech bubble, a chat box pops up. Just type your message in the box at the bottom, hit enter on your keyboard, or click the icon that looks like a little paper airplane. And that's it. So go ahead and type in your questions. Like I said, keep in mind that these messages are public. And also, if we're not able to get your question answered, or if you think of one later on, that's not a problem. We will be sending a follow-up email to you after this with a short survey, and you'll have a chance to ask a question that way as well. So with that, go ahead, ask your questions, and we'll get as many answered as time allows. Okay, first question here. Is the 7-day return to play a recommendation for mild or no symptoms? How will the typical Guthrie trainer handle this?
So yeah, the 7 days are recommended even if you do have the mild symptoms. I think it could potentially be delayed for someone who does have some more severe symptoms. They may bring them back more slowly. So yeah, even if they were having less symptoms.
Okay. Next up, so are there any recommendations for an athlete who may have tested positive a while ago, maybe back in September and October, not needing to complete an RTP prior to starting school sports again?
Yeah, Jay, we've run into that for a while too. And honestly, what I've been telling the schools is if someone actually has tested positive in the past, I wouldn't necessarily, it depends on if they had gotten back to practice. So if they're just starting practice now, then I would like to have them do the gradual return to play. But what I was finding after we had started the return to play process, we had kids that had pretty much gotten back to full practice. Their athletic trainer said they had no symptoms. I wasn't going to make them go backwards for it. So, but I'd say if they are starting out again, after they've even a remote diagnosis, it's not a bad idea to start gradual at the beginning of the season anyway. It's just basically what Brian and Caitlin said. Or Emily, I'm sorry, Caitlin.
So going back to that first question quickly, will the 7 days be required from the Guthrie trainer?
Not sure the question would it, so if it's a school where our trainer is at, they would be kind of following them, and the athlete would start out with easy, start stage 1, they check in with the trainer and how are you doing? Okay, go to stage 2, and they would be guiding them through, again, very similar to what we would be doing for concussions. So they would, at other, and other places maybe doing it a little bit differently, but that's the kind of the way that they're going to be guiding it.
Okay.
I'm not sure if that answered the question. And that's, like I said, I know that Jay Hubbard's on. I don't know if they do anything different over at UHS.
Dr. Pica, this is Jay. At UHS, we do try to work with the coaches as much as possible. We do monitor, as you mentioned, and then in a case that the coach is capable or able to work the athlete through it under the athletic trainer's direction, we're allowing that mainly to be able to manage the numbers of return to plays, so our athletic trainer isn't just crushed with return to plays every day.
Yeah, I think that would be reasonable. So as long as the coaches have a good relationship with the trainer and they know what they're looking for, I think that would be totally reasonable. And just have a good communication between them. So I agree.
Great, thanks. So I've got a question here about youth sports. So they mentioned that youth sports don't necessarily have as many resources as the schools do. So how would you prefer coaches move forward if the parents don't provide the documentation that we showed?
I think that if I would probably be looking at the fact and the recommendation you have with any other injury. I would say if you're kind of aware of the guidelines and just educate the parents, maybe even at the beginning of seasons, and let them know that we are going to be expecting that, or let them know the process you're following. As a group, as a youth group, I'd probably set your criteria, make it known to people, and just follow your criteria. I don't know, Dr. Gator, do you have any other ideas on that too?
Honestly, Dr. Pikett, I mean, you know, with the increased incidences of these myocarditis in kids, I would probably err on the side of caution. Probably ask the coach to hold the student back until we have some documentation, or at least some, you know, some workup to sort of clear them, because a lot of these kids, you know, I know as much as they're eager to go back to sports, we sort of have to look at their long-term, you know, trajectory, and sort of keep their health safe for the long run, right? Not just, you know, not just that one, you know, season. But so I guess I would, you know, ask the coaches to hold the kids back until we get some sort of paperwork.
Great, thanks. So next we've got a question on gym class participation. And basically, you know, do you have any recommendations on, you know, how they might be able to monitor the athlete or student and work with them through gradual return, especially if they have gym every other day?
I think this is time you can empower your nurse, again, going over the guidelines with them, and we do the same thing with concussions, where we don't, for the gym people that the athletic trainer may not have contact with them, let them check in with it. It is tough when they have gym every other day, so it is a little bit of a slower process for them. I don't know if any of their presenters have any other ideas.
I would say, you know, sort of inform them of like the most important things to watch out for, like the chest pain or tightness with exercise. You know, as we said before, like that is one of the more lingering symptoms post-COVID. And sometimes it can take a little bit of time for that to really resolve. So if they, you know, if they notice that the kids aren't, you know, keeping up, you know, doing laps, or they're starting to have that discomfort, that might be time to sort of, you know, take them aside and at least make them aware that that's probably one of the more important symptoms to watch out for, so that they can inform us, you know, if it's worsening or if it's not worsening.
All right, next question here. I know Emmeline mentioned that, you know, everyone should have a time limit that we follow for training, especially with children. You know, she mentioned it should be their age. But specifically related to COVID, you know, if someone had a positive COVID diagnosis and now they've recovered, should there be, you know, an even stricter time limit for training for them?
I would say I would go back to the stage to return to play. So if they can go back through that stage progression and they don't have symptoms that reoccur as they're working back up to their prior level, I would use that as your guide. The time is just kind of a general recommendation, really, to prevent overuse injuries in the youth athletes, especially as sports specialization is becoming more common. So it's really trying to prevent the overtraining at a young age. Still recommending like cross training, doing different types of activities. But if they are back to full level and had no symptoms as they went through that progression, I would then go back to that time recommendation.
I think I'd go through the guidelines we had on that form, or that Brian had in his the presentation on each stage. I think it did have a limitation on time with that, and I'd probably be limiting somewhat after they get back to full participation based on any symptoms.
Okay. And sort of in that same vein, you know, a student who has a pre-existing heart condition, if they're the ones returning to play, is there, you know, something more strict that they should be following?
I think as part of that workup, as part of like the pre-participation, seeing their primary doctor or seeing a sports medicine physician, a workup should probably include like an EKG, troponins, cardiology consult. I do know that some other sports medicine doctors would order like a cardiac MRI as well, to see if there's any muscular changes. So probably for an athlete who has had prior cardiac dysfunctions should have more. I mean, granted, if their symptom presentation wasn't as severe, then play it by ear. But if their symptoms were serious, then they should have a further workup in the cardiology consult before returning. What do you think, Dr. Pikett?
Yeah, I would agree. I think those are people that I would go into that higher category where they would get the further workup as well as seeing a cardiologist.
Good to know. Someone who has tested positive more than once, is there anything different that they should do when returning to play?
Honestly, I'm not really sure if the fact that they had more than once would make a difference. I think it might go with the severity, how long they were and how sick they were. So I would probably just go based on their symptoms and their exam, and how they're feeling. I don't know if there's a greater risk. At least I haven't heard. Again, Dr. Guido, have you heard anything about that?
No, actually, I haven't. From what I've heard, it's just sort of symptom severity and symptom presentation sort of dictating, what's the next degree or level of testing.
Okay. And this next question is going to embarrass me because it has to do with pronunciation, which I'm not great at. So someone asked if there's any concerns. I don't even know if I'm going to try this. If Dr. Guido, Dr. Pikett, if you could look in the chat at this and pronounce it for me. Again, I'm so embarrassed. I'm sorry.
The rhabdomyolysis. Is that the one you're talking about, Kate?
Yes, yeah. So rhabdomyolysis and DVTs. Are there any concerns with that?
There, after any kind of viral problem similar to the myocarditis, you get a little bit concerned. Rhabdomyolysis means breakdown of the muscle, the skeletal muscle, like in your arms, your legs, or stuff like that. So that can happen. So I would be a little bit concerned, at least when they're acutely ill. After they've recovered, it's not as bad. The concept of DVTs, people with COVID are at greater risk for DVTs. So, because they tend to be clot a little bit more easily. So I think it would be something we would be looking for as far as leg swelling, arm swelling, and definitely if they had acute onset of shortness of breath. So I think it was out there. It tends to be the people that really tend to be very sick, though, the people who are hospitalized. Rex, do you have anything else?
No, I've heard the same, Dr. Pikett. There is increased risk for, thromboembolism risk with COVID-19, but I can't say for certain if it's any higher than what, the risks would be for other viral illnesses. Either way, it's important for us to sort of stay alert, especially with that shortness of breath, chest pain complaint, to just be a little bit more vigilant. Obviously, doing it within reason. But if it sort of continues to persist, or we notice that it worsens and we see all the other ancillary signs of clots, that we should sort of react a little bit more quickly than we would if there weren't.
All right. So that seems to be our last question. Like I said, I will be sending out an email with a survey. So if you think of any questions before then, you can ask it through there and we will get back with you. But so I guess that concludes our Q&A session and also brings us to the end of our seminar. So thank you again to Dr. Guido, Dr. Pikett, Emmeline, and Brian for your presentations and for sharing your expertise with us. And thank you to all of our participants for joining us for this seminar. I hope everyone found this helpful, and I hope you all enjoy the rest of your evening. And most importantly, continue to stay safe. All right, thank you, everyone.